as a clinician and researcher focused on survivorship research, we always try to find new ways to improve our research and to make it very impactful for our patients. And one of the major needs right now is to understand how we can propose a more predictive, personalized, and preventive medicine in survivorship care among cancer survivors. So the idea is really to tailor survivorship medicine according to the individual characteristics of the patient. We now have this very consolidated knowledge that there's a number of issues that persist on the long term after cancer treatment. So we are now able to treat effectively a number of cancers, but we do leave a mark on the life of our patients and on their quality of life. So by knowing the risk factors and by being able to stratify our patients and understand who is going to follow a more regular pattern and who is going to be more impacted with a declining and persistently declined quality of life, this can help physicians adapt the pathway of care accordingly. So in our recently published editorial in Asthma Open, we give this perspective of how understanding the biology and the biological underpinnings of these long-term effects, we can improve our management of the disease and perhaps go towards a more personalized and even preventive type of survivorship care. So what I mean is that we now know that there's a number of clinical factors and treatment-related factors that can impact the trajectory of our patients and of their quality of life and symptoms. If we couple to this knowledge, better knowledge about biology, we can improve our way to deliver personalized medicine. And so far, the majority of the evidence has been focusing on cancer-related inflammation and inflammatory-related pathways that are associated with several conditions that are related to cancer and cancer treatment. For example, cancer-related fatigue and several other behavioral symptoms such as cognitive dysfunction, insomnia, emotional distress may share a common underlying biological inflammatory basis. So by targeting this inflammatory pathway, we actually can better treat the symptoms. One example is, again, exercise and cancer. So exercise targets symptoms by modulating inflammation. So that really can help our patients reduce inflammation and therefore reduce their symptoms. Of course, not everything is inflammatory related. There's also a number of other pathways that we have to explore. Exercise, in this example, can also modulate metabolic, cardiovascular risk factors, but it all goes into the direction that research should be focused on finding biological mechanisms that can be tackled and therefore can really help our patients develop a more normal trajectory with recovery after breast cancer treatment and in general all types of chronic conditions.